Well, with so much talk about the COVID-19 vaccine, there's another vaccine that we want to remind people about, and that is the one for HPV. Let's welcome Dr. Kimberly Levinson, Director of Johns Hopkins Gynecologic Oncology at GBMC. How are you?
Hi, how are you? Thank you so much for having me. I really appreciate the opportunity to talk with you today.
I'm happy to have you here. And before we jump into the HPV vaccine, let's just talk about in general what HPV is.
Yeah, so HPV stands for human papillomavirus, which is actually a double-stranded DNA virus that we know commonly affects the cervix or the uterine cervix. So this is the virus that is responsible for cervical cancers and unfortunately causes cervical cancers and is found in about over 99% of cervical cancers. And so we know that once a woman has become exposed to HPV, that although many people will be able to fight that virus and won't have repercussions from it, in some women, it will go on to create issues, including cervical cancers.
And so explain to us about the HPV vaccine, how it came on the market, came to be, and what it helps to do.
Yeah, so, for prevention of cervical cancers, we basically have two different strategies. We've got primary prevention strategies, which means we want to try and prevent the disease from occurring before anyone ever gets the virus, okay? Or we have secondary prevention mechanisms, which help us to detect disease early on and then treat it before it does something bad. And so the HPV vaccine is our mechanism for primary prevention, and that means that we want to try to prevent people from acquiring HPV viruses that would go on to cause cervical cancer. And so by obtaining vaccination before a patient is exposed to the HPV virus, we can prevent that virus from ever causing an infection in patients and then going on to cause bad repercussions such as cancers. So this really is a wonderful strategy for us to try and prevent any of the repercussions of HPV viruses, including not only lower genital tract cancers, including cervical and vaginal and vulvar cancers, and anal cancers as well, but also oropharyngeal cancers, which is obviously very important in men as well.
And so explain to me the difference, and you started talking about cervical cancer, but the difference between cervical cancer and cervical dysplasia.
Yeah, so cervical dysplasia is essentially a precancer. So cervical dysplasia basically is once the HPV virus has started to create changes in the cells to create abnormalities in the uterine cervix, but before they've gone on to be able to invade other tissues or become a cancer, which is the definition of cancer, to be able to invade other tissues and go anywhere they'd like to go. So the goal of the secondary screening, which we started to discuss, is really to pick up these changes before they go on to produce a cancer and to be able to intervene to remove those abnormal cells before progression.
So how often does this screening occur?
Yeah, so screening is really individually independent. And so, the easiest thing to say is right now, if you've had a negative pap smear and negative HPV testing over a period of time, then you wouldn't need a subsequent screen until another 5 years. However, for patients who have had a history of abnormal pap smears and or abnormal HPV testing, our screening algorithms are really what we call risk-based at this point. So we take into account patients' histories, any history of abnormal testing, abnormal biopsies, and then look at actually what the risk is for a cervical dysplasia or a cervical cancer, and then make adjustments to how often a woman needs to be screened based on exactly what their personal risk is. So it's very individualized, and there's not really an easy answer, and it really is something that each individual needs to discuss specifically with their individual practitioner.
And that was the next question I had for you, is that why do people need to keep being screened? It definitely depends on the individual.
Yeah, that's exactly right. I mean, throughout most of our lives, and right now, our screening protocols still say that up to the age of 65, for those women who have had completely normal history of screening for the past 20 years, that women at the age of 65 might be able to exit screening at that point. I want to clarify that that's not true for patients who have had a history of dysplasia, because of course, their risk still may exist for having a cervical dysplasia or cervical cancer. However, during that time period, up until the age of 65, even if you've had negative screening, it still is important to be screened, because HPV virus can subsequently cause changes to the cervix, which could go on to lead to a dysplasia or a cancer.
A lot of helpful information and something that should be top of mind. I'm assuming that we can all go to the website, correct, to get some more information and get in contact with the practice.
That is exactly right. Yes,
All
I
right.
think you can see our website there, and we're always happy to answer any questions that you have.
All right. Dr. Levinson, thank you so much for all of this important information. And we'll be right back with more Midday Maryland right after this. Stay tuned.